It's December 2nd, 2021 in British Columbia, Canada. Sasha Tymkiw is at home. It's a cold Thursday evening when she notices she's received a letter in her mailbox. This seems like a normal letter. I mean, she looks at the front page. It's dated November 29th and it's from the Provincial Health Authority. Now, for Sasha, a letter from the health authority probably doesn't raise any red flags. I mean, it was just a few months ago she had an operation at the hospital to remove a polyp from her uterus. Maybe this letter is just a follow-up. Maybe it's a survey, who knows? Sasha grabs this envelope, she opens it up, and she takes out the letter. And it starts off fine. I mean, "Dear Ms. Tymkiw, the hospital is committed to providing patients with the highest quality of care." Whatever, normal stuff. This letter seemed just fine. But it was when Sasha read the second sentence of this letter when her heart would immediately drop. "We are writing to you today to inform you that we recently learned an individual who had been hired to provide care at the BC Women's Hospital did not have a valid license. We have determined that this individual was involved with the care you received." Sasha is dumbfounded. She begins thinking about her time at the hospital. Who was her nurse? Who treated her? And it didn't take her long to start connecting the dots. It wasn't just Sasha who received this letter. It was Amy Field. It was Vanessa Sari. It was Paige Morris. In fact, it was over 1,000 patients. More than 1,000 patients all received this letter, that a nurse who had seen them at the hospital had been a fraud. Who was this nurse? Who was this fraud? And how could something like this go on for so long? This case will leave an entire nation shocked, and you'll seriously be taken back by the absolute rabbit hole of a criminal history that this serial fraudster had. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. All right, let's get into this case. On April 11th, 2022, a journalist named Sarah Treleaven wrote an article on Maclean's titled "The Nurse Imposter." The following information regarding a person named Kayla is from that article. At a hospital in British Columbia, Canada in 2021, there was a woman who, for privacy reasons, used the pseudonym Kayla. Now, Kayla had struggled with endometriosis for the majority of her life. According to Mayo Clinic, endometriosis is an often painful condition in which tissue that is similar to the inner lining of the uterus grows outside the uterus. And it would be due to this condition that Kayla would soon be scheduled for surgery to remove endometrial tissue at a hospital called the British Columbia Women's Hospital, or BCWH, in May of 2021. During that spring of 2021, Kayla arrived at the BC Women's Hospital ready to get on with this procedure. And when she got there, she would be greeted by her attending nurse, who was a woman named Melanie Smith. Now, Kayla described this nurse as being, quote, around 50, loud and boisterous, with clumpy mascara and frizzy black hair. But while these were already interesting descriptions she had for the nurse, they weren't even close in oddness to what would soon happen next. At this appointment, Nurse Melanie was supposed to insert an IV into Kayla's arm. However, as she tried to do this, after multiple attempts, Nurse Melanie just kept on repeatedly failing. She kept on inserting the needle and moving it all around Kayla's arm, trying to find a vein, but she wasn't able to successfully do this. And eventually, she had to call a colleague to come help out. While this was a little odd, they eventually were able to get the IV in Kayla's arm, and so they were able to continue with whatever it was they were doing. But it was what occurred during one of those failed attempts of inserting the IV when Kayla would be just left absolutely puzzled. At some point while Kayla was sitting there in the chair, she had briefly turned. And when she turned, she'd accidentally brushed her arm on Nurse Melanie's breast. Now, after this happened, Kayla was like, "Oh my gosh, I'm so sorry." And she just tried to apologize. But as she was apologizing, Nurse Melanie just started laughing hysterically. And according to Kayla, Melanie then grabbed Kayla's hand and used Kayla's hand to cup the breast that she accidentally grazed. Now, Kayla was completely caught off guard by this. Here's her nurse laughing very loudly after failing to put in an IV, and this nurse just used her hand to cup her breast. But Kayla just generally thought that Melanie must have had just bad bedside manner, and she kind of just left it at that. Now, Kayla went on to get the surgery to remove the endometrial tissue, and the surgery went by successfully. But while everything with the surgery was all good, It was what happened after that kind of changed everything. After the surgery, Kayla managed to remain unconscious for 12 hours. And even after being discharged from the hospital, she continued to sleep for a further 18 hours at home. Not only this, but Kayla noticed that she was covered in large marks and bruises. But when discussing this with the BC Women's Hospital, they weren't able to explain where those might have come from. Now, several months would go by after this procedure. Kayla seemed to be doing just fine. Her recovery was going well when all of a sudden she noticed that she received a letter. When she looked at the letter, she saw the letter was dated November 26, 2021, and it had come from a place called the Provincial Health Services Authority, or PHSA. Now, the PHSA is a publicly funded health service provider in the province of British Columbia. The PHSA operates and manages 11 well-recognized specialized programs and services, including the BC Women's Hospital and Health Center, or BCWH. So, as Kayla opened up that letter, she must have figured that it had something probably to do with her time at the hospital just a few months prior. Maybe it could be a check-in, maybe a survey, whatever, it probably wasn't much. But as she read that letter, Kayla would be left absolutely astounded. Because in that letter, she read, quote, "We are writing today to inform you that we recently learned an individual who had been hired to provide preoperative nursing care at BC Women's Hospital and Health Center's gynecology surgical program did not have a valid license with the BC College of Nurses and Midwives." This letter further went on to read, quote, "This individual is no longer employed in the gynecological surgical program, and BC Women's/PHSA is reviewing this matter comprehensively to determine how it occurred, any internal processes that may have contributed, and potential impact to patients." As Kayla continued reading this letter, she saw that they stated that the Vancouver police were conducting an investigation, and she further read to see the letter end with an apology for any distress that the letter may have caused. But in a circumstance like this, an apology kind of didn't really do too much, because after reading this, Kayla's heart dropped immediately. She immediately started thinking about her encounter with Nurse Melanie just a few months prior, and she quickly went to search on Google to see if she could find a picture of that very same nurse who had used Kayla's hand to cup her breast. She soon found a picture of this nurse, and surely enough, she was eventually able to identify this nurse as the individual detailed in the letter. Kayla subsequently requested her medical records to see everything that went on when she was in Melanie's care. And after reviewing them with her primary physician, Kayla was left even more stunned, because she soon discovered that during her time at that hospital, she had been administered a, quote, "bizarre cocktail of drugs, including fentanyl." And after going through her records in more detail, she described, quote, "My doctor told me I absolutely should not have been given a lot of the things the nurse gave me. It's a gynecological thing. You're in stirrups and you're sedated. You're supposed to have people you can trust to take care of you." Kayla immediately felt a sense of violation. She was in a hospital getting a vulnerable procedure done, and she couldn't stop thinking about who this fake nurse was and what they might have done to her while she was in that room unconscious. This woman was not a nurse. In fact, this woman's name was not even Melanie Smith. This woman was named Brigitte Cleroux, and what investigators would find out about her past would be truly startling. Brigitte Denise Cleroux was born in Ottawa, Ontario, Canada, in or around 1972. Ottawa is the capital of Canada, and it's known for being home to Canada's Parliament Hill and Rideau Canal. Growing up, Brigitte had little to no relationship with her father, who she didn't really know. And although she was at some point close with her mother, this relationship eventually would kind of fall apart. A pre-screening report later on in 2022 would actually detail that Brigitte's poor and troubled relationship with her parents would be a major contributing factor leading her to a life of crime, especially in her youth. Because it would be just in her teen years when Brigitte would find herself encountering some troubles with the law. In just 1991, at 19 years old, Brigitte had committed and had been convicted on fraud charges. She pled guilty to impersonation and forgery in Quebec, and she was subsequently sentenced to 1 month in jail. After being sentenced for this crime and released from jail, things didn't seem to get much better for Brigitte. From the year 1991 to 2001, from the ages 19 to 29, Brigitte found work as an exotic dancer. However, during that time, she also continued with a lot of fraudulent practices, specifically regarding fraudulent credit card and check use. I'm unsure exactly when, but sometime between that decade of 1991 to 2001, Brigitte had spent a good chunk of time in the United States. More specifically, specifically, she lived and worked somewhere in Florida. Now, in 1992, according to corrections records, Brigitte was convicted in the United States for both larceny and possession of counterfeit documents. And as a result of these convictions, she served time in detention and probation. Not only this, but also between 1992 and 1994, Brigitte also committed a series of crimes including multiple frauds, impersonation, and forgery. For all these crimes, she served a global or cumulative sentence of 2 years and 6 months. And this wasn't all the charges she would face at this time, though the outcome of her next charges are unknown. According to corrections records, Brigitte incurred further charges in the US from 2000 to 2002. Now, obviously, I can only assume Brigitte didn't necessarily want to continue leading this life of crime, because it was in fact in 2001 when Brigitte had actually moved to Colorado to enroll in nursing school. According to her friends, Brigitte had always had a passion for nursing, so it wasn't a surprise that she decided to go to school for it. This program was supposed to take 4 years to complete. But the thing is, this dream of hers unfortunately didn't last that long, because according to her, after the school had learned about her criminal record, she was apparently ousted from the program. So Brigitte didn't complete nursing school at all. She only spent 2 years there before leaving. After leaving the nursing school, Brigitte did have some significant milestones occur in her life. She soon met a man whom she fell in love with, and not long after, Brigitte was pregnant with her first child. Now, even though Brigitte wasn't able to complete nursing school, she did have other things that she was able to successfully accomplish. She received training in the beauty industry, and she even worked in that field as well. Not only this, but at some point, she found work as a restaurant manager. So she might not have been able to become a nurse, but she had other avenues where she was able to find and have legitimate employment. And while it looked like things could have been going in the right direction for Brigitte, this unfortunately would not be the case, as she eventually would end up going back down a path of fraudulent activities. Now, despite her lack of credentials, Brigitte was able to land employment as a nurse in Colorado Springs. This appointment lasted very briefly, as she was eventually caught for this, and she was subsequently charged with forgery and impersonation before the charges were dropped. It wasn't too long after this, in the beginning of 2002, when Brigitte fled the United States to head back to Canada. And it was shortly after this, in March of 2002, when she gave birth to her daughter. Brigitte settled in a town called Rockland, Ontario, and it was there where she married a man named Mario Marie. According to reports, the couple did appear to be happy. However, it is of note that when marrying her, Mario had not been aware of Brigitte's criminal past. And even with being back in her home country, Brigitte continued with her crimes as a fake nurse. Brigitte soon was able to find work as a nurse at a small hospital in Ontario, still without a license. To get this position, she apparently falsified the credentials of an actual legitimate nurse. But this wouldn't last too long, because again, Brigitte would be eventually caught and charged with falsifying the nurse's credentials. For this crime, Brigitte received a sentence of 6 months in prison, followed by 2 years of probation and a fine of $60,000. But again, even with this sentencing, Brigitte still continued with the crimes, just this time taking a break from the nursing scene. In 2006, in Gatineau, Quebec, students at a school called Philemon Wright High School were out of a stable French teacher. During that time, numerous teachers had come and gone through the year, but none had stayed. So they needed a French teacher to be there to teach their students, and this opened up an opportunity for said position. In October 2006, the high school was fortunately able to find somebody, and soon enough, this teacher got on with working at the school. This teacher was named Madame Marie, and she arrived to teach the students some French. Now, if you're able to guess where I'm going with this, Madame Marie, of course, was not actually Madame Marie. Madame Marie was instead simply a pseudonym used by Brigitte Cleroux. And as with almost all of her previous employment positions, Brigitte did not have the qualifications necessary to teach French or even teach at all. A 10th grade student who had been taught by Madame Marie at the time would later recount her memory of Brigitte. They described Brigitte as one who always wore heavy makeup, tight jeans, and low-cut leopard print tops. Not only this, but the student would detail stories that Brigitte would tell them about the times she would go to parties on the weekends, and they mentioned that Brigitte told them that she apparently was intimate with not just her husband, but also with a boyfriend on the side. And while these, of course, are just descriptions of Brigitte's questionable actions at the school, most importantly, Brigitte's French lessons clearly demonstrated that She did not have a comprehensive understanding of French, and definitely not the kind of understanding needed to teach the language. In her classes, she would simply just teach her students simplistic verb conjugation, which is essentially the very basic. And what stood out is that for one lesson in particular, Brigitte actually had decided to show her students a French movie. And her student would later recount the movie, stating, quote, "The only way I can describe the film is as porn. It was a literal orgy." So this is what she was showing to high school students. Not only this, but the movie had apparently not even been in French. The student continued describing, quote, "We were confused and just kept looking at each other, but we were awkward high school students and none of us really knew what to do. She was laughing at all of us. She was like, 'Why are you so uncomfortable? I know you're all having sex.' Most of us were like, 'Please let me die in this chair.'" It's not funny, but it's like, girl, what? Not only this, but another student of Brigitte's claimed that she would often pick on the weaker kids in the class. And the student even went as far as to state that Brigitte would encourage bullying, stating, quote, "She was condescending and mean, a nasty person. It made things difficult, like I had a target on my back." Fortunately for her students, Brigitte's time employed as a French teacher would be short-lived, because abruptly in December of 2006, she would leave the position. The yearbook would go on to list Madame Maurier's name, but with no picture, and Brigitte was simply marked as missing. In the first half of the year 2007, Brigitte had moved from Quebec to Calgary, Alberta. With this move, she had actually followed a friend and neighbor of hers by the name of Joël Ferrand Fournier. The two families lived together in the same rental house, and in this house, there were 4 adults and 4 kids, which included Brigitte's husband Mario and her 5-year-old daughter. Joël would describe Brigitte as, quote, "A caring friend, someone who would babysit and help make ends meet, someone who was always there." And Brigitte seemed to show a very special interest in Joël's work. Why? Because Joël worked as a nurse. Brigitte would often ask Joël a lot of questions and pose hypotheticals with respect to nursing. And Joël would later state, quote, "She would tell me things and then just double check everything by me to make sure she was right." While it seemed like Brigitte was just this curious mind who wanted to learn more about the field, what Joël hadn't been aware of, though, was that not only was Brigitte effectively attempting to gain just enough nursing knowledge to not cause alarms if questioned, but Brigitte was essentially grooming Joël for her nursing license. Between May 23rd and June 1st, 2007, Brigitte used the personal information of her employer to apply for a credit of $65,000. And surely enough, this loan was approved. Now, it's not reported who her employer was at the time, but fortunately, her employer was notified about this loan that had been approved on their account. And because of this, they subsequently fixed it, and Brigitte did not actually end up receiving the money. But this wasn't all Brigitte did with this employer, because she also used this employer's information to apply for 2 credit cards, one of which had been used for an amount less than $2,000. Now, shortly after this, Brigitte must have left this employment, because it was in June 2007 when Brigitte again applied for a job as a registered nurse at the Richmond Square Medical Clinic in Calgary. For this application, Brigitte presented a forged registration certificate that she had obtained from Ontario using the name Melanie Gauthier. And it didn't take long before she was hired by Richmond Square Medical Clinic, despite not being licensed, as again, she only had completed 2 years of a 4-year nursing program in the States. But it's very interesting because this too was short-lived. Brigitte worked at the clinic for only 2 weeks before being fired. And during that time, she administered 2 injections to patients, earning her a total of $505.96. It's unclear why she was fired. However, the charges that were brought against her for fraud imply that it was discovered that her forged documents were fake leading up to her termination. Now, in early 2008, Joël and her family moved back to Ontario while Brigitte stayed in Calgary. And now with Joël kind of out of the way, Brigitte was able to take her schemes just to the next level. On February 20th, 2008, Brigitte took a trip to the registry office with a birth certificate and a bill from a utilities company called Enmax. The thing is, these weren't her documents, nor were they her bills. These were documents that had been in the name of her very friend, Joël Fournier. Using Joël's information at the registry office, Brigitte went on to apply for an ID card in the name of Joël. And subsequently after, a temporary card was granted and given to her before a permanent one was mailed. Now, she was in fact close with getting away with this one. However, Brigitte's deception was shortly discovered after a fraud recognition system from a motor vehicle branch actually flagged a picture of her. They saw the picture that Brigitte had taken on the 20th of February for the temporary card, and their system was able to match it for another photo that was taken earlier under her real name. Now, even with this happening, Brigitte still continued with her fraud. On May 21st, 2008, she applied for a position as a registered nurse at a medical clinic, and she again presented a forged registered nurse's certificate to complete this application. It was with this forged certificate, Brigitte was hired, and she subsequently worked for 2 months at the clinic at a rate of $22 per hour. And like the last clinic, management would soon discover the invalid certification and Brigitte would be confronted. Now, even though Brigitte denied to management that the certification was forged, she was subsequently fired from this clinic. And with losing her nursing position, Brigitte decided to go back to one profession that she felt comfortable with, and that is teaching. The court records detailed that from August 28th to December 15th, 2009, Brigitte worked as a teacher despite, again, having no education nor authority to teach in Alberta. And how did she get the position this time? Well, she completed this application with forged documents, including a baptismal certificate and a security check in another name. During this short stint at working as a teacher, Brigitte earned a total of $13,289. Now, just about 5 days after she was done with this position, Brigitte found herself in a little bit of a problem regarding where she was staying. On December 20th, 2009, an issue arose with Brigitte and her husband about a landlord and tenant matter. And this issue was enough for the police to get involved because the police were called and they subsequently spoke to Brigitte and Mario about this incident. Now, dealing with the police, it probably would have been in Brigitte's best interest to be truthful, at least regarding her identity, as that is something that they can easily find out. However, as a common theme in this case, Brigitte was not truthful with her identity. Mario gave the authorities ID that used his real name. Brigitte, on the other hand, provided ID to the authorities that used a false name. This false ID easily flagged with the police, and they were quickly able to find out Brigitte's true identity, leading them to look into her records and subsequently arrest Brigitte on outstanding warrants. Considering she had outstanding warrants, I guess that explains why she at least attempted to give a false ID, so maybe she could avoid getting arrested, but that was not the case. Just a few months after this, in July 2010, Brigitte was released on bail pending trial. And after failing to appear for a court appearance, a warrant yet again was issued for Brigitte's arrest. Brigitte was not trying to show up in court and deal with these charges, so she fled Alberta to head back to Ontario. And it was after this when the College and Association of Registered Nurses of Alberta subsequently issued a public safety alert that stated that Brigitte Cleroux, under the name Brigitte Cleroux Marier, had been charged with impersonating a registered nurse and had engaged in, quote, acts considered dangerous, including administering injections, amongst other things. She didn't stay on the run for too long because Brigitte was eventually located in Ontario and was subsequently arrested and sent back to Alberta. On September 27, 2010, one of the court cases against Brigitte took place, and she was charged with uttering a forged document and obstruction of a peace officer. In court documents, her name was listed as Brigitte Denise Marier, and on October 28, 2010, they completed a pre-sentence report on her to get a better idea on how to move forward with sentencing. In this report, they detailed that Brigitte had access to a psychologist in January that year before being locked up, and they suggested that Brigitte might have been on track to becoming more responsible simply due to being a mother to her young daughter. However, this assessment was contradicted by the timeline of her offenses, as her daughter was 8 years old at this point. Not only this, but the report also mentioned that she had even been accepted to an Elizabeth Fry Society house in Ottawa, which had programs to help deal with theft, fraud, prevention, and addiction issues. But it was further stated that she was not accepted to go there while on bail. And it wasn't just things like behavior that they looked at, but they also looked at her criminal history. And what's extremely interesting, though, is that in this pre-sentence report, they seem to be missing some very important information. This report just appeared to have a significant gap in Brigitte's criminal record. To be exact, the report seemed to be unaware about Brigitte's fraudulent activities between 2007 and 2010, as it showed that she only had 3 convictions since 1997. But like we know, this was not the case. She had committed multiple offenses between 2007 and 2010. In fact, prior to 2007, Brigitte had amassed a significant criminal record, including 48 prior offenses for dishonesty and 2 prior convictions for attempting to obstruct justice. On October 28, 2010, Brigitte went before the Honorable Judge P.B. Barley for sentencing on the 2 charges. At the sentencing, she presented 2 character letters, one of which had come from her mother-in-law and the other from her best friend. And she eventually pled guilty to both charges. Oh, and by the way, those character letters she used were actually forged as well. And something that emerged from later investigations is that during her job applications, Brigitte would often get references by posing as a former boss. In fact, it's stated that she's given herself a, quote, 5 out of 5 on a range of assessment categories, and that she's described her key strengths as, quote, honest, loyal, and dedicated to her job practice. Just a few months later, on December 21st, 2010, Brigitte was released from custody on something called a recognizance. And this essentially is a promise made by someone in a court of law, most notably being a promise to return to the court at a later date. With a recognizance, if a person were to break their promise, they would have to pay money to the court. So in terms of Brigitte's promise on being released from custody, she was meant to report to probation within 2 business days and to reside at an address in a city called Airdrie in Alberta. But if you can guess where I'm going with this, Brigitte did not in fact report to probation as required, and she instead decided to go from Alberta to Ontario, ultimately breaching her conditions of release. And while on release, she continued doing things that got her locked up in the first place. Brigitte was part of a business with a woman named Cheryl Largis. And the following day after her release on December 22nd, Brigitte attempted to cash a check from that business. She went to Money Mart to cash the check despite not receiving the required permission from Cheryl. But fortunately, this attempt failed and no money was received. Brigitte finally returned to court on February 8, 2011, and it was there where she pled guilty for fraud valued under $5,000 and for uttering a forged document in relation to her crimes when employed at the Richmond Square Medical Clinic in 2007. Just a few months later, on June 10th, Brigitte was sentenced for her crimes in Alberta on 13 charges, encompassing offenses committed between 2007 and 2010. Justice Barley, the judge on the case, stated, quote, both the education and medical systems are of great importance to the public. People must have faith that individuals in these systems are qualified. The only way that this can be ensured is to have qualifications put in place by the authorities and then have those requirements rigorously enforced. The use of forged documents attesting to these qualifications makes a mockery of attempts to ensure that the public is well served by qualified individuals. Brigitte received a total sentence of 60 months or 5 years in prison. However, due to a pretrial detention exceeding the changes made to the Canadian Criminal Code, Brigitte was granted a 25-month or 2-year reduction in her sentence. Now, despite this lengthy sentencing, it was reported that between 2015 and 2018, Brigitte continued committing a series of crimes in Quebec and Ontario. And even before that, during the summer of 2013, Brigitte applied for a position as a hairstylist in Ottawa under the name Brigitte Cleroux. She was hired for this job, and while her boss, Lucas Nault, described her as pleasant with a sense of humor and a sweetness, he later on was able to recognize some of the red flags Brigitte displayed in this position. He stated, quote, she asked odd questions every so often that should have been a no-brainer for someone with that much experience. But there was never a complaint, never an issue. Every client liked her hair. Despite Brigitte appearing to lack knowledge on some of the basics of hairstyling, she overall appeared to do the job competently. But it was just 3 months after she started working at the salon when Lucas would receive an anonymous email. And it was after reading this email when he would discover that Brigitte had an extensive history of fraud. This email contained a mugshot of Brigitte in addition to information regarding her prior convictions and statements from Brigitte's previous colleagues. Lucas was taken back by this email, but he didn't want to just judge without hearing Brigitte's side of everything. So he invited her for a coffee to discuss that email. At this meeting, he assured her he had no intentions of firing her. He just wanted to hear her out. But it was as soon as he showed her that printed email and discussed what it entailed when Brigitte immediately began bawling. She told him, look, that's not true. I can't do this anymore. And it was at that point when she got up and straight up left. She didn't grab any of her expensive hairstyling equipment, nothing. She left and never returned to the salon again. Not just this, but from September to December 2017, Brigitte not only fraudulently obtained employment as a nurse at 3 senior care homes in Ottawa, but while working at one of these homes, She actually stole checks from a 102-year-old resident, and in doing this, she took over $23,000 from him. This was amongst much other things, including defrauding a landlord for rent and stealing from a small business owner. Details surrounding the trials are sparse. However, for these crimes, she eventually pled guilty to theft, fraud, impersonation, identity theft, and forgery. Brigitte received a sentence of over 2 years for the convictions entered between February to November 2018. Now, after completing her sentence in 2019, Brigitte ended up moving to British Columbia, or BC, Canada. And it was there in BC when it seemed that she was turning a new leaf in life. While on parole in BC, she was actually able to find real legitimate employment as an unregulated care provider, or UCP. This is a role where one would essentially assist individuals with personal support and activities of daily living in a variety of care settings. Being a UCP, like in its name, is unregulated. Thus, it's a role that does not require a nursing license. However, the downside to this, mainly in Brigitte's case, is that this means it doesn't pay as much as a registered nurse, for example, who of course has very important medical responsibilities that are detrimental to one's health. Because of this, it didn't take long for Brigitte to get tired of this job. She wanted to get paid more, and so she left her position as a UCP to pursue fraudulent nursing jobs that offered higher pay. Brigitte soon went back to what she's done many times before, and she was successfully able to obtain a job at a medical clinic using fraudulent nursing credentials again. In early spring of 2020, Brigitte began working as a nurse at the Royal Arch Masonic Home in Vancouver, British Columbia. Now, she wasn't employed directly by the care home, but she had been employed through a third-party contractor. And at this position, Brigitte decided to go by the false name Melanie. More specifically, as Brigitte would continue her fraudulent nursing endeavors, she would use credentials under the name Melanie Smith. And these credentials she was using weren't just random fake names. No, she used the name Melanie Smith, who was an actual qualified nurse employed in Vancouver. Now, a registered nurse who had worked at the Royal Arch Masonic Home at the time remembered Brigitte as having some interesting characteristics. She described Brigitte as being someone who took constant smoke breaks, and she remembered that Brigitte would repeatedly reference her impressive credentials, which included her education in the States. She was actually able to demonstrate familiarity with palliative care, as she was able to check vital signs and administer medication just fine. Not only this, but Brigitte had also found work at a dental clinic in Surrey, British Columbia as a dental assistant. The exact dates of this employment is unclear, though it's reported to have been prior to May 15th, 2020. Now, Brigitte's employment at the dental clinic wasn't too long, but she did manage to get some things done during that short time. Before leaving, she was able to forge the dentist's signature to steal and cash in on 5 company checks, obtaining a total of $8,000. It was finally on the 15th of May 2020 when Brigitte's parole from her convictions in Alberta had expired, and this would kickstart her plans at a new and even bigger facility. Just a few weeks after her parole ended, on June 1st, 2020, Brigitte began working as a registered nurse at the BC Women's Hospital. Now, we're gonna need just a little bit of background on the BC Women's Hospital to just get a better understanding of everything that was about to transpire from here. The BC Women's Hospital is a Canadian hospital located in Vancouver, British Columbia that specializes in women's health programs. It's listed as the only facility in Western Canada that is dedicated to the health of women, newborns, and families, and is the largest maternity hospital in Canada. The BC Women's Hospital employs more than 1,000 full-time and part-time staff, and it provides a broad array of services, including providing care and treatment to outpatients through its gynecological surgical services program. This program provides elective surgery for a variety of gynecological health issues and other procedures. Now, patients who undergo procedures at the BC Women's Hospital are assessed in order to determine if that patient is suitable for procedural sedation or general anesthesia. And the difference between these is that with procedural sedation, one is only semi-unconscious, whereas with general anesthesia, one is fully unconscious. For procedural sedation, particularly at PHSA hospitals, a patient is given IV medications, fentanyl and midazolam by a nurse, and this is supposed to be done in the presence of both a surgeon and a circulation operating room, or OR nurse. The goal of procedural sedation is to decrease the patient's perception of pain, and this is generally obtained through the administration of analgesics combined to a sedative. Procedural sedation also increases the likelihood of a successful procedure while decreasing the time required to perform it. Not only this, but it also increases the safety for the patient and personnel tending to the patient. Part of the services offered by the Gynecological Surgical Program at BC Women's Hospital took place in the Post-Anesthesia Care Unit, or PACU. This is the section of the hospital where patients would receive post-operative care in certain phases. More specifically, the PACU had 3 phases: Phase 1, Phase 2, and extended observation. The focus of Phase 1 care in the PACU is to ensure that the patient fully recovers from anesthesia and that the patient's vital signs return to near baseline. This is generally limited to only those patients who receive general anesthetic or anesthesiologist-led sedation. And the focus of Phase 2 care is to prepare patients for a hospital discharge to go home. Now, at the BC Women's Hospital, on a daily basis, Brigitte worked as a general duty nurse in the preoperative PACU Phase 1 and PACU Phase 2 regions of the Gynecological Surgical Services Program. In that role, Brigitte not only worked in pre-screening for procedural sedation, but she conducted preoperative assessments, administered procedural sedation, provided post-operative care in both Phase 1 and Phase 2 of the PACU, and would have been assigned as a float nurse covering for other nurses in Phase 1 and Phase 2 of the PACU. Again, she was doing this all the while not having the certifications or training to work as a registered nurse. And it was during her time here when more details regarding her inappropriate and unprofessional behavior with coworkers and patients would be revealed. Sometime around November 2020, some concerns were raised about Brigitte having inappropriate conduct towards an anesthesiologist. So because of this, the BC Women's Hospital placed her on paid administrative leave, and they issued a warning letter to her as they investigated. And it was just on December 1st when this turned into an actual discipline, because they not only issued her a letter of discipline, but they also briefly suspended her. Now, she was initially supposed to be suspended for 3 days, but this was later reduced to 1 day for separate incidents. And it was while she was on paid leave when she still kept herself very busy. Brigitte managed to get work at a place called View Royal Surgical Center in Victoria, BC between October and November of 2020. While she did manage to get employment there, this position would only last for just about 3 weeks, because after multiple reports of her, quote, lack of professionalism, her poor nursing skills, and her bedside manner, Brigitte ended up resigning. The most common descriptions for Brigitte coming from both colleagues and patients were simply that she was condescending, loud, or rude. And it appears she just brought these characteristics with her to every clinic that she went to. Fortunately for her, by the time she resigned from this clinic, she was all good to go back to BC Women's Hospital. And it would be when she returned to the hospital when her plans were beginning to come to an end. In response to an incident a patient reported about Brigitte on June 4th, 2021, Brigitte Cleroux was placed on paid leave as the PHSA investigated. And it was during part of that investigation when the PHSA learned that not only was Melanie Smith not Melanie Smith, but they weren't even able to confirm if Brigitte had been registered as a nurse in the first place. So because of this, on June 23rd, the PHSA fired Brigitte immediately. And after she was fired, the PHSA initiated what they called a, quote, quality and clinical review of patient care provided by Ms. Cleroux to BC Women's Hospital patients. Just the next week, on June 30th, a public advisory warning was put out by the British Columbia College of Nurses and Midwives, or BCCNM, stating, quote, BCCNM received a report that Melanie Smith has held herself out as a registered nurse in British Columbia in order to seek employment in a hospital, dental surgery clinic, and in residential care. Melanie Smith may also be using the names Melanie Thompson or Melanie Cleroux. This person has never been and is not a registrant of BCCNM and is not entitled to practice as a registered nurse in British Columbia. So now, while they may not have known that the nurse's name was Brigitte, they knew that this particular Melanie was not legit. And the public at least now had a warning that there was this fraudulent Melanie on the loose. Still, even with this warning posted, Brigitte continued working fraudulently as a nurse at different places. Between February and August of 2021, Brigitte was able to obtain 2 jobs at 2 medical clinics in Ottawa, again using false nursing credentials. And just a month after leaving the BC Women's Hospital, Brigitte was able to successfully apply for a nursing position at a place called Originelle Fertility Clinic and Women's Health Center, or OFCWH, under the name of Melanie Smith. And she got hired at this clinic on July 26, 2021. While working at the Originelle clinic, Brigitte carried out and performed nursing duties that included injecting patients with intravenous needles and administering drugs. But it would be just on August 11, 2021, when Brigitte's employment at the Originelle clinic abruptly came to an end. And this was because she was confronted by another nurse who had been concerned about the way she was administering care to a patient. After this confrontation, Brigitte immediately quit working at the clinic, and the nurse who confronted her began initiating a complaint with the nurses' college. And this is where things started to get interesting, because it was when the nurse put in this complaint when she soon discovered that this Melanie Smith person was not a registered nurse in Ontario, and that instead, this Melanie Smith happened to be a woman named Brigitte Cleroux. After this was discovered, the police were subsequently called to investigate, and things started ramping really quickly right there. Just 5 days after abruptly quitting her position as a nurse at the Originelle clinic on August 16, 2021, Brigitte applied yet again for another nursing position, still using the name Melanie Smith. She placed her application and she subsequently got the job. She was hired as a nurse at a place called Argyle Associates, and she soon got on with the position there. During her first week there, Brigitte provided care to at least 12 patients, including a child. So when she got there to start the next week on Monday, August 23rd, she was ready to do the same old things she did the previous week. After spending the morning treating patients at Argyle Associates, Brigitte eventually went on her lunch break. And she decided that she would use this lunch break to collect her last paycheck from her previous position at the Originelle clinic. When she arrived at the Originelle clinic, she was wearing her Argyle's nurse uniform, and she walked right in to pick up her last paycheck. But it was as she was doing this when police showed up and Brigitte was arrested and taken into custody. When the PHSA finished their review and investigation, they began getting letters ready to send out to patients. And soon enough, starting on November 29, 2021, they issued 2 versions of a patient disclosure letter informing the recipients that Brigitte Cleroux was not a licensed nurse and that she had been involved in their care. After receiving and reading this letter, many patients came forward online to share their stories. One version of this notice letter was sent to 899 individuals, where Brigitte was directly involved in charting in their care, whereas the second version was sent to 258 individuals of whom Brigitte was indirectly involved with their care. And of these 899 individuals was a woman named Sasha Tymkiw, who happened to be the first patient to go public about this case. In an article posted on December 3rd, 2021, Sasha described her very uncomfortable experience that she had with Brigitte during her time at the hospital. While at the hospital for a relatively routine procedure to remove a polyp from her uterus, Sasha described that during her procedure, she was in so much pain that despite Brigitte giving her pain medications, the surgeon had to stop the procedure. She described, quote, "Nothing was helping, and it got to the point where I was kind of squirming away from the surgeon. I remember my legs were just shaking, so there was so much pain." And she further went on to detail how she tried to hold in the pain as she believed it was normal. In hindsight, she knows that this pain was not normal at all. For a procedure like this, pain should not be 10 out of 10 and excruciating. And had a real nurse been treating her, she probably wouldn't have had to have such a troubling experience and deal with such pain. Sasha wasn't the only person to come forward. Multiple people came forward online citing similar stories of strange encounters they had as a patient of Brigitte's. During the 2022 case against Brigitte, there was at least 8 identified patients who were detailed of having strange encounters with Brigitte during her time at the Originelle clinic. And it wasn't just patients who detailed these experiences, but it was her own colleagues as well. Brigitte would soon be charged with 7 offenses, including impersonation, fraud, assault, and assault with a weapon. And it would be during the pre-screening report for this case when some very significant things would be pointed out about Brigitte. As part of a pre-screening report, they looked at Brigitte's extensive criminal background. Notably, the case files state that Brigitte had 67 convictions as an adult in addition to youth convictions. They stated that at the time of this report, she had been 50 years old, unmarried, and that she had an adult daughter. I'm not sure when she separated from her husband, but she did eventually. And the report also noted that Brigitte had, quote, incurred fraud charges consistently since her youth, admitting that her behavior was motivated by financial gain. Not only this, but as part of this case, Brigitte was also psychiatrically evaluated by a physician named Dr. Wood from the Royal Ottawa. Through his assessment, Dr. Wood cited previous comments that Brigitte had made, stating, quote, she would engage in fraud to soothe her feelings rather than experience emotional discomfort, and she tended to be impulsive for most of her life. And she had a desire to present a facade that showed she was successful based solely on the items she owned. The report stated that Brigitte had a very limited social circle. While she had developed friendships in BC, she wasn't able to maintain these friendships, and this was simply because she had lied to them about her identity. Not only this, but Brigitte's relationship with her daughter had been severely affected by the significant periods that she was incarcerated over the years. Brigitte's daughter actually told the psychiatrist that she did not know her mother very well, and she stated that her mother had never discussed her criminal history with her. Brigitte didn't suffer from addictions, she didn't suffer from drug or alcohol issues, but Dr. Wood did soon have a diagnosis for her. Dr. Wood diagnosed Brigitte with a few different personality disorders. More specifically, he diagnosed Brigitte with antisocial personality disorder, borderline personality disorder, and narcissistic personality disorder. The diagnosis of antisocial personality disorder stemmed from the pervasive pattern of disregard for and violation of the rights of others. This also included borderline personality disorder, which stemmed from the pervasive pattern of instability of interpersonal relationships, self-image, and also included marked impulsivity. The diagnosis of narcissistic personality disorder, on the other hand, was characterized by Brigitte's actions of being interpersonally exploitative, wanting to be perceived as having a higher status, and lacking empathy at the time of committing her offenses. In addition to these diagnoses, Dr. Wood also diagnosed Brigitte with a depressive disorder in relation to the current legal predicament and parent-child relationship problems she was dealing with. What's very interesting is that Dr. Wood actually stated in his psychiatric report of Brigitte that he was rather pessimistic about her prognosis, mainly due to the, quote, extensive and long-standing criminal history of repeated behaviors that often involve taking advantage of others or misleading for personal gain. And because of her, quote, accumulating further charges while still on parole and under supervision. Dr. Wood also voiced his concerns that although Brigitte acknowledged committing her offenses, she had a tendency to place the blame externally and paint herself as the victim. Most importantly, Dr. Wood noted that despite the fact that Brigitte had committed serious crimes, including assaults and assaults with a weapon while working as a fake nurse, he noted that there had been no indication in her crimes that Brigitte ever had an intention to physically harm others. And because of that, Dr. Wood didn't note Brigitte as a high risk of violence in the future. This is the principal defining factor of Brigitte. She hadn't intently set out to physically harm others. You could argue that to some degree, she must have been aware that her lack of training and lack of certification could put her patients at considerable risk. But from Dr. Wood's reports, it's evident that Brigitte truthfully hadn't been thinking of anybody but herself. It's likely that the well-being of her patients had not been a thought that crossed her mind when she forged credentials and fraudulently obtained a nursing job. Nonetheless, regardless of whatever her intent was, the impact she left on her victims was still especially heavy. Several patients described the effect Brigitte's treatment left on them through numerous victim impact statements. One patient that Brigitte treated at the Originelle clinic described in her victim impact statement how the fertility IVF process is already one that is, quote, stressful, costly, and filled with anxiety and fear. But to add that with the additional knowledge that she had been treated by a fraudulent nurse was something that caused her immense stress and eventually led her to go into therapy. Another patient from the same clinic also spoke of feeling a, quote, strong sense of betrayal, particularly since one's healthcare team is in a position of authority and our natural instinct is to trust those administering medication and performing physical procedures. A mother of a child patient described the stress she felt knowing Brigitte had treated her daughter at the Argyle clinic without having the qualifications. And another patient from the Originelle clinic described how she had lost faith in the clinic as a result of Brigitte's impersonation and fraud. Not only were patients affected, but the actual nurse that Brigitte had used as an alias was also affected by this. Melanie Smith was a real registered nurse, so to have her name be used around for such a crime, that's something that would affect her reputation. The impact that Brigitte's impersonation of Melanie Smith had on the actual real nurse, Melanie Smith, is something that's not often reported on, but it's something that is significant. It can't be understated how detrimental such a hit to the real Melanie Smith's reputation regarding anything related to her career would be. Take, for example, when you do a simple Google search for Melanie Smith nurse, some of the first things you'll see are articles about a fraudulent nurse. Of course, when looking into it, one is able to discover the true story, but this doesn't take away from the fact that at first glance, it would be very stressful and painful for the real Melanie Smith to ensure future employers and even patients to know that she is not Brigitte Cleroux and that she is in fact a victim of her crimes. Justice Robert Wadden, the judge overlooking Brigitte's case, noted several factors, saying, quote, Ms. Cleroux's fraudulent impersonations of a nurse breach the trust our society places in the healthcare system and the highly regarded profession of nursing. This behavior must be denounced in the clearest terms. A sentence must be imposed that would deter anyone else who might engage in this behavior for their own financial gain. Further, a clear message must go to Ms. Cleroux, specifically that her repeated criminal acts will receive strict sentences in light of her long criminal record and her failure to stop committing fraud. Judge Wadden further went on to describe how Brigitte hadn't been deterred by a 5-year sentence in 2011, nor had she been deterred by the numerous lesser sentences that she had incurred after that. He noted that Brigitte continually repeated the same exact type of crime that she's been found guilty of before by impersonating a nurse. And he noted that these are crimes that had involved planning and premeditation. Brigitte had to prepare and use forged documents. She had to continue engaging in ongoing fraud on a daily basis while working at each of these clinics. And because of all of these factors, he believed that the sentence that should be imposed on Brigitte should be one that's longer than any of those previous sentences. The Crown initially sought a sentence of 10 years for Brigitte. However, despite believing she should have a longer sentence, Judge Wadden believed that a sentence of 10 years for Brigitte as a, quote, 50-year-old nonviolent offender would be excessive. Brigitte was soon able to admit that her actions of administering needles to the 8 patients at the Originelle clinic while fraudulently posing as a nurse constituted as assault with a weapon. Not only this, she admitted that by her physically dealing with 12 patients at Argyle Associates, by doing things like removing needles, for example, constituted as assaults since the patients had been deceived about her qualifications. And with this, Brigitte subsequently pled guilty to all 7 offenses on January 14th, 2022. The sentencing for Brigitte's case took place on April 22nd, 2022. At the sentencing, Judge Robert Wadden stated, quote, at both Originelle and Argyle, Ms. Cleroux chose fraudulent employment that put her in physical contact with patients, including giving injections to women undergoing fertility treatments. It is one thing to impersonate a nurse and defraud the clinics of money. It is another thing to follow through and physically deal with the patients under that pretense. Brigitte was soon sentenced to 7 years in prison, but with credit for the pre-sentence custody, Brigitte was technically sentenced to a remaining 68 months, which is 5 years and 8 months, to be served in federal prison. Not only this, but a sample of her DNA was also taken, and she was prohibited from the possession of firearms, ammunition, or explosive substances for 10 years. Of course, this was a very complex case with many people involved, so it didn't take long for lawsuits to ensue. On November 25th, 2022, a woman named Miranda Massey filed a notice of application for certification for a class action lawsuit against the PHSA. This, in simpler terms, is an application to get a judge to approve a class action lawsuit taking place. Miranda Massey had been one of the approximate 1,150 patients who were cared for by Brigitte when attending gynecological surgical procedures at the BC Women's Hospital. She had attended the BC Women's Hospital for a gynecological surgery sometime around January 2021. And while there, Brigitte had been the nurse who was assigned to her and who participated in her surgery. It was only around the end of November that same year when Miranda Massey received a letter from the PHSA stating that an unlicensed nurse had been involved in her care. And surely enough, Miranda soon found out that the unlicensed nurse was Brigitte. With this proposed lawsuit, Miranda brought up common issues including negligence, battery, breach of privacy, vicarious liability, and for damage, including aggregate and punitive damages. And as the one who began this lawsuit, she proposed to be the plaintiff to represent the case if it were to move forward. Now, just a note, Brigitte was not named as a defendant in the proposed class action. This was a class action lawsuit against BC's Provincial Health Authority, PHSA, as they were Brigitte's previous employers. Miranda complained in this lawsuit that she had received care at the BC Women's Hospital from Brigitte, who was employed as a registered nurse by PHSA despite her not being licensed and despite, quote, using falsified documentation and or credentials which PHSA knew or should have known about. And she further complained in this lawsuit about Brigitte having access to very private medical procedures, records, and information. Now, Miranda wanted to apply to bring a class action lawsuit against the PHSA because they were the ones who in fact had hired Brigitte, allowing her to work there despite using fraudulent credentials. But despite the reasoning she had, the PHSA actually opposed the application as they believed that they shouldn't have been liable for Cleroux's fraud. They stated that the PHSA, quote, has not in any way tried and is not trying now to evade or avoid responsibility, and continued by stating that certifying an application for the lawsuit would not be legally appropriate in the circumstances of this case. This proposed class action lawsuit would include all residents of Canada who had been patients at BC Women's Hospital and who received treatments either directly or indirectly from Brigitte between June 1st, 2020 to June 30th, 2021. And for this, Miranda gave evidence from 5 other individuals who had described aspects of their experiences as patients of the BC Women's Hospital during this time. These experiences were said to be, quote, diverse and individualized. Some included specific conversations people had with someone who they believed to have been Brigitte. Some included instances where they stated they had negative experiences with Brigitte. But nonetheless, they all had a common theme of just being a strange experience overall. For example, one patient cited that Brigitte had given them medication in a manner they considered painful after waking up from surgery. Another described not only the discomfort Brigitte caused when taking their blood, but the fact that they believed Brigitte gave them gas as a painkiller before the surgery. Likewise, one patient described being administered IV medication, one described Brigitte managing their sedation, and one described Brigitte administering IV fentanyl for them. And they all similarly described the conversations they had with Brigitte regarding things like post-operative pain or the level of their breathing. Now, the PHSA submitted evidence that indicated that Brigitte did in fact partake in activities one would do in a nursing role. However, as evidence for their side of the lawsuit, the PHSA stated that Brigitte never claimed to be an OR-trained nurse, and also that she was never assigned as a nurse in the OR whenever patients underwent general anesthetic or anesthesiologist-led sedation. And they also stated that Brigitte claimed to be trained as a procedural sedation nurse, stating that because of this, she hadn't been permitted to work in the OR during procedures involving anesthesia, and that she was only permitted in the OR when administering procedural sedation. Not only this, but they highlighted the steps they did take to address concerns raised about Brigitte. This included the times she was placed on paid leave for them to conduct their investigations, and it included the disclosure letter they sent on November 29th, 2021, informing patients about what had happened. But despite the actions they took, this didn't take away from the many deficiencies that would have allowed Brigitte to have continued her fraud for so long at this hospital. Miranda Massey claimed that the PHSA is liable to the class members for the following: negligently hiring Brigitte Cleroux and breaching the standard of care to take reasonable steps to ensure that nurses who treated the class members were properly licensed and reasonably competent, committing the tort of battery on every class member that Brigitte Cleroux treated, and committing the statutory tort of willful violation of privacy on every class member. Miranda also further claimed damages for for herself and class members, including punitive damages. Between the 27th and 28th of February 2023, 2 hearings took place in Vancouver regarding the certification application. And on July 25th, 2023, Justice Stevens officially approved the class action lawsuit against the PHSA based on breach of privacy, vicarious liability, and punitive damages. As for the claims related to negligence and battery, these were dismissed as they required individual trials and detracted from the commonality of the class action. I'm unsure about further updates regarding the class action lawsuit brought against the PHSA, but in more recent news, on August 16th, 2023, new charges were filed against Brigitte for fraud over $5,000, impersonation, using forged documents, and assault, all related to her employment at the View Royal Surgical Clinic in the fall of 2020 in BC. At the trial for this, Brigitte was said to be emotional as she clutched a box of tissues appearing in front of the BC Supreme Court judge. And on July 19th, 2024, Brigitte pled guilty to 11 criminal counts in BC, including assault, fraud, and using forged documents for her actions while impersonating a nurse at the BC Women's Hospital and at the View Royal Surgical Center. There is a stop publication order in effect for this portion of the legal proceedings, so not much information is available about the particulars. According to CBC, Brigitte's next hearing was supposed to be last month on October 9th, 2024, and she was supposed to be sentenced regarding a different location this fall. But with the publication ban, I couldn't find anything else on this. This case was definitely a roller coaster. It's just very interesting seeing how something could go for so long without much being done about it. Hopefully with the slightly longer sentencing, once Brigitte is out, she doesn't continue doing stuff like this. And it's also hard to tell when you look at the prognosis that Dr. Wood had, with him being pessimistic about the prognosis. But I guess you can only hope that this would be the last time, and maybe when she gets out, she would be older, as he did mention, so maybe she would want to settle down and not continue doing stuff like this. But I don't know. I just hope it all works out in the end, and I hope that the people involved in the class action and all the patients and everyone affected, I hope they're able to get some kind of resolution for this. But yes, that is it for today's case. What are your thoughts on this story? Do you think Brigitte should be serving more time? Do you think the sentencing was reasonable? Should it be longer or shorter? Do you think everything's going to be fine when she gets out? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.